Well, research has come out, according to the World Health Organization, that lung cancer is the second most common cancer worldwide, with 2.21 million cases and 1.8 million deaths. It comes as there's a warning of second-hand smoke from other people's cigarettes, whether they be pipes, shisha or cigars, can also put people at risk. To get more details on this, we are joined by Dr. Abdul Rahman El Kinge, the consultant medical oncologist at FUH University Hospital at Dubai Silicon Oasis. Doctor, thank you for your time on CSB.
Thank you for having me. Good evening.
So now, Doctor, a lot of conversation, obviously, we keep talking about this on how harmful smoking is and what one should do to stay away from smoking. But then a lot of research has been done on passive smoking also. If you could throw some light on that, please.
Well, actually, we have two interesting topics, not only the second-hand smoking, but also the third-hand smoking. And the difference is that the second-hand smoking, as you said, that your friends or people around you are actually smoking and you are not. That's the second-hand smoking.
Right.
The third-hand smoking is actually totally different. When actually people smoke in the room, they leave the room, and you come to this room, you're also exposed to what's left over of the smoke. So you're also at risk of having increased risk of lung cancer if you also have a third-hand smoker. So that is really shocking, because not only the smoker has put himself at risk, but also his family, his friends, his surroundings, and it's putting the community around him at risk of having not only lung cancer, but multiple different types of cancer.
Doctor, when I was about 18, I used to go out to parties and I'd come home and my dad would want to hit me over the back of the head because I was come into the house stinking of cigarettes. and he thought I was smoking and I was bringing in this bad smell. And now you're telling me that obviously there is a passage of time. But I've never heard this research before, but third-hand smoke, how much research has been done into this?
There have been a lot of research about that. The only problem is that it is not easy to calculate your risk of second-hand smoking or third-hand smoking. We know how to calculate the risk for the smoker, but for the second-hand, third-hand, it is there. The research has proven it, that actually you are at more risk, but it's not easy to calculate your risk. But eventually you are at risk in an environment of smokers.
Right. So what should one do? You can't really avoid that. You can't really, sanitize the whole room before someone has left. I mean, if you go into an office or probably just go into a cafeteria where someone has already smoked, you can't be running with a spray and sanitizing the whole place before you enter. How does one try and prevent that?
It's not about sanitization of the air. Eventually, it's about how you can remove the smoke particles from the air, and it's not easy at all. You need to have really a good air system, but you have to follow the international laws. When actually you're not supposed to smoke within clubs, you're not supposed to smoke within restaurants. Whenever it's a public place, when you go to the States or to the UK, in a public space, you're not allowed to smoke. So this is a smoke-free area. If you wish to smoke, you just go outside and outdoor and you smoke, and that's the best way how to decrease your risk to have second-hand or third-hand smoking whenever you go outside to the public.
No, I think this is a fascinating insight. When it comes to people who are at risk for smoking and second-hand smoke, are people over the age of 50 more at risk?
It's not only the age. The age, for some, no doubt. The older you get, the more at risk you are exposed to smoking and other carcinogenic. But the main key is how much you smoke during life. What we calculate is something we call it pack year. That means the number of packs of smoke per day for how many years. So we call it pack year. So the bigger the number, which is 20, it's usually the cutoff point, is puts you at risk. Not only the age. The age factor is important, but how much you smoke and for how long you smoke is the most crucial risk factor that puts you at danger of having lung cancer and other types of cancer.
Right. So how often should one come and get themselves checked, or are there some specific tests that one has to do, and how often?
Now, the clear guidelines, and we follow by the guidelines of the American Task Force for the lung cancer, is patients or people who are at high risk again. So they are really smokers, and usually more than 20 pack years, 50 years of above, yes, but if you could be 40 years and you smoke, you probably start smoking at the age of 14. So what we advise these people that are high risk that to present and do a low dose CT scan 3 times per year. And now why we say low? Yeah, 3 times. Why low dose? Because you don't have to put too much radiation during putting the images. And why CT scan? Because the typical chest X-ray that people do fail to detect the cancers at an early staging. So the CT scan is more accurate to detect it at a low dose level of radiation.
Mm-hmm. And you said that 3 times a year.
3 times a year, yes, because you need to detect the disease in a very early stage in order to do a surgery. The purpose of early screening, and again, I reiterate and concur on the idea that early screening saves lives. This is very important.
That is
so
true.
the purpose of doing early screening, detect the disease in a very early stage, do an intervention, very simple, cure without adding more therapy such as chemotherapy, immunotherapy, or any type of therapy. So when you detect the disease in a very early stage, you just do wedge resection, you just do a surgery, you remove it, and most of the time you do not need to take any therapy. So this is what we aim at, doing the minimal invasion to cure the patient without any treatment after.
When it comes down to second-hand and third-hand smoke, symptoms aren't really as prevalent as someone who is a smoker, is it?
No, the symptoms are the same.
Okay.
Someone who has, let's say, we advise people who have long-lasting cough, especially dry cough, people who have hemoptysis, what we call it, that is blood when they do the sputum, someone who have recurrent shortness of breath, they have lost some weight and without explanation, without dieting, cannot exercise easily, they feel their stamina is decreasing with time. These people, we advise them to seek medical help. And as such, during this time, they can do further workup and could be a low-dose CT scan if the physician see that they are at high risk of lung cancer, to do the proper imaging to diagnose it.
Right. So when we say that prevention is better than cure, obviously for the smokers it's always good to stay try and reduce smoking or quit smoking. But for the ones who are passively inhaling that smoke, what could be the advice to those, doctor?
The same as you advise everyone, stop. Please advise your relatives or your friends to stop smoking, because eventually you find it difficult that you say, I'm not going to hang out with you because you're smoking. Or you can tell your friends, let's say, please respect my environment as the way I respect you. You can smoke, let's say, 1-2 cigarettes or a bit far away from us. This can be, but this is very difficult. Socially is not very applicable. It all depends on your friends, how much they are understanding. But again, the main issue is that there should be laws that probably you should stop smoking in public places. In that way, everyone can be safe, and it may help everyone. Second, third-hand smoker, or even the smokers.
No, this is really good. I mean, one thing for sure, that with this information that you've given us about secondhand smoking, and not just secondhand but third-hand smoking also, we're trying to create this awareness, trying to pass on this message through this entire month of November, and try and ensure that we keep people aware, keep people free from this dangerous situation that they might fall in at the later stage of time.
Yeah, and as parents, parents who smoke, you have to know that in the same room that you're smoking, your kids will be there, and you're putting your risk on your kids because they are so young and you're exposing them at a young age. The risk of having a cancer could be earlier than we expect, but before the age of 50. So this is something they should take into consideration.
Well, Doctor, this is something that I think is a very important topic to have, and something that really does need awareness raised on it. So we do thank you for your time this afternoon here on Talk 100.3.
Thank you so much for having me, and good luck.
No, thank you. There is Dr. Abdul Rahman El Kinge, the consultant medical oncologist at FUH University Hospital at Dubai Silicon Oasis. So it's a reminder that non-smokers should also get screened for lung cancer, and also second-hand and even sometimes third-hand smoke can also produce risk. That is a statement issued by the lung cancer by many clinics, including the Cleveland Clinic in Abu Dhabi. You're on TSB Talk Sport Business on Talk 100.